Our startup portrait. Please welcome Osman, CEO and co-founder of Agora Care. Very pleased to welcome you because you are also a startup who were in the Tech for Trust and in the Trust Valley ecosystem, so the floor is yours.
Thank you, and good evening, everybody. Since I only have 4 minutes, which is very frustrating for me, and it's very late, I'm going to skip all the introductions, all the slides explaining who and what. I'm just going to show you a picture. This is the title. Sorry, I left that one. This picture shows what you get if any of you went for an X-ray, an MRI, a study in one of the very famous, reputable 2 academic hospitals of this region. One of them, I've been the chairman for 12 years, and I couldn't get rid of this. It's a CD, or it's a card with a code, and the password is always your date of birth. I don't know why. And it's not just academic centers. It's even in very large, very reputable networks of healthcare, radiology and others. The problem is that, of course, you can't use that. That's a problem for the patient. Do you still have a reader for a CD reader? Most of you don't. And the security is sort of The problem couldn't be solved. We tried everything. We tried the European project. We tried Swiss funding. We tried CARA, and we tried other things. Still couldn't do it. So I retired, and we said, let's change it. Let's give it. First thing is the problem for the patient, but it's also the problem for the referring physicians. They can't get the data when they need them. And the number of data that are being repeated because they cannot be read is huge. There is an impact in patient care, and there's an impact on economics. Billions are being wasted every year because we have to repeat the study or redo it. So we changed the paradigm. We put the patient in the driver's seat. We created a bank. We're in Switzerland. A secure bank, not a cloud of those famous GAFA. Our own secure bank and server in Switzerland. And it has all the security, all the necessary compliance, ISO and others, so that the patient has a very trustful environment where he can have all his data. And we go and get the data on his request. And he or she can decide who should get the data when. And can share with anybody. It's one click from her or his laptop or phone or other things. We put a huge effort in reinventing, forgetting everything academic we did, reinventing a new environment, easy to use, very fast, both for patient and for referring physician. It's really extremely fast for a very large data set. It's click, boom. Oh, by the way, I use very difficult jargon. It's my background. Quick, boom means fast. It's extremely fast, gets all your images in one place, and you can browse in your whole life in 1 second. It allows to share with anybody, have just a code, or you can send an email, which is encrypted and has all process. You can have all the data in one place, and now we're extending beyond imaging. You can have also your lab results and other things. Imaging is the most difficult part. And it can be also, as we heard it today, a secure source of having the patient enrolled into clinical trials, AI research, and other things, because now you have the patient that consents and has access to all his data. You don't have to have the patient on one side, get the data from another side, and get all these things together. So right now we are in the region of Suisse Romande. We're about 13,000, 14,000 patients. We're having tested the whole system on many institutions and practices. We're extending to some large radiology networks to see how it goes into the different instances. The patient can enroll by themselves. It's very simple. It's like when you open an account or do something, you just have to go through a process. We're looking forward for the EID, which is probably going to solve a lot of this. But yet, you have to do it yourself. It can be a brochure. It's all over the place in the waiting room. So the secretary will tell you, just go there, scan this code, open this, and click, boom, images come back. Remember the term. And we also are thinking about the referring physician. For referring physician, they need to have all this. It's a waste of time, a waste of energy. And physicians can now, through our system, request us to go and get the data for him, even if the patient doesn't have an account. That's funny, because you can tell the patient that you're going to do it. We send an SMS, say, your doctor asked us to do it. And if he says yes, basically he consents. And then we now do the job for the doctor, go get the images from wherever they are, send them back to the physician, and he can access that before the patient goes to a consult or to a surgery. Of course, we inform the patient under this process. And if he wants to see the images, open an account. Your images are already there. We also designed it a little bit more complex because now there's groups of clinicians that need to have their own data. Now it's the big thing. I want my data of my patients. Well, we can make it virtually your own data, but they're actually in the bank. So basically, we create something called a SNAP, which is an environment or sort of a mini archive for a group of patients or a clinician. And they have their patient list. They think everything is on their disk, but actually it isn't. It is on the cloud, and every time, click, boom. So doing this, we extend it to networks. And the network have the same problem. So we have integrated to what we call now managed care network. We heard it this morning. They can get images from everywhere. So I'm going to skip all these things. We're also complying with the Swiss EPR, whoever wants to know it. And we think that better care happens when patients control their own medical record. Thank you.
Thank you so much, Osman. Great pitch. So right